Bit more tenderness, musculo-tendinous junction. So we flatten it out. We might just roll on top. Nah, not much there. Back down that way, there's a bit more.
There's plenty there.
Plenty on that. So we'll just sit on that, all while just controlling using my body weight. And it's pretty effortless here. So I can just, in a half lunge sort of squat position, and yeah, just applying constant pressure, working through. G'day, Jason Ninja here. I'm going to do a video today on knee pain. So if you've previously had any structural knee injuries, or you've just got non-specific knee pain that you can't get right, you've seen some other people, you've been to doctors, specialists, and they can't tell you what's going on, this is what we can do. So we can treat, we're pretty much going to show you every area that we can treat that can have an effect on the knee. So we're going to start with the quad, because yeah, a lot of people, once there's pain around the knee, the quad starts to tighten up and get overactive, and that can lead to a lot of imbalances around the knee. So particularly on the lateral side of the quad, so this vastus lateralis and ITB area can get tight, and that can pull the patella, or it can cause pain on the outside. But you can also get pain, top of the kneecap or in the patella tendon. So it's always good to start up here through the quad and just have a look what's going on. And there's already a bit there for Ninja.
Right from the start, man.
Yeah. This is just a broad stroke, but you can already feel where there are tight spots. Might even get some referral pain into the knee, so that's pretty common if the quads are quite tight and stuck and dehydrated. You can get a lot of referral pain. So it might feel like day to day you get that pain in the knee, but it could be coming from a tight spot up in the quad here. So yeah, if you've had a lot of scans and nothing really shows up in the knee, it could just be muscular issues that are causing you pain. So that's where we can come in and just clean it all out. Yeah, it's pretty brutal stuff here. Yeah, you've had old knee injuries though, haven't you,
Yeah,
Nin?
man.
But you don't have any pain anymore. You've dealt with that yourself and got yourself right.
Yeah.
But yeah, you've also treated plenty of people with knee pain, and
yeah, that's all right. So
pretty common thing, isn't it, that people just can't get that result, or they've got all the scans and not sure what's caused it.
Yeah.
And
So,
it tends to mean that there's something muscular or an imbalance in the body that's causing it, and that's where we can come in and obviously treat clean first, build second. So treat the pain, clear the body of any pain or dysfunction, and then get you in the gym, get you going through our strength training or rehab, whatever it is, to strengthen up around that area. So we can do one through the middle of the quad as well. So a bit more through the rec fem. So that's where it attaches up into the hip, and then trace it down. So it doesn't feel as much in here for Ninja.
It's a bit better.
But yeah, again, this can be a common tight spot for people.
Whoa.
So staying connected and always just getting feedback from what you feel. So we might not necessarily start on the quad, depending on where your knee pain is, we'll start what's appropriate to that. But just for today's video, this is just where I wanted to start with. But yeah, particularly if you've got pain at the top of the patella or the side of the knee, this is typically probably where we'd start. And then, working through. So once we've done a couple of warm-up strokes, we've found where we need to focus on, and we can start to bring in the bigger tools. So we can get a forearm or an elbow in there, which Ninja will love.
Yeah, I'm loving it.
So we'll start more on that lateral line again. So sinking in. So we sink in, get to the point where we feel there's a bit of resistance or hardness in the tissue, and then we'll slowly start to move through. Pretty dry there at the moment, so I might get a little bit of wax on the elbow just to get a bit of movement. And just by rotating, different aspects of my elbow can hit that quad, but it can also start to move through. So yeah, down there we can feel a bit. Any referral, Ninja, or just localised?
Yeah, bit of awareness into the knee actually.
Yeah, so you can more outside of the knee.
Maybe inside.
Inside,
I don't know why.
Feels like it wraps around.
Yeah.
Yep. So there you go. Not everyone's the same, yeah. So you can get different referral patterns. So that's why it's always good to check in and see what you're feeling when you're getting this treatment. Or if you're a practitioner delivering it, yeah, always check in and see where the pain, if there is referral pain or where they're feeling it, because that can give you some important information.
Dear.
And just making sure they're not fighting us too much. We're in that productive pain barrier. Although Ninja's struggling a bit, we know we're doing some good work. It's not too traumatic, but we're getting the work done.
Whew.
Staying connected, we go all the way down to the knee. Keep going, working through. We need to flatten out a little bit here as we get down, gets a bit more tenderness, musculo-tendinous junction. So we flatten it out. We might just roll on top. Nah, not much there. Back down that way, there's a bit more.
There's plenty there.
Plenty on that. So we'll just sit on that and wait for that to soften up again. All while just controlling using my body weight. And it's pretty effortless here. So I can just in a half lunge sort of squat position and yeah, just applying constant pressure, working through. Alright, and so for that part of the body we could do a bit more, but we're just going to move on and show you a couple of different areas. So now, let's say there's a bit more pain down on the lateral aspect. We can start actually where that ITB attaches. So we're hooking on, starting on top, onto the knee bone there, on that lateral side, and then we just roll off. And now we're in there, and there's always a pretty common spot. It's sort of this far is where you tend to get the worst of it in the ITB down there. So it can be pretty red hot for a lot of people. But this area can contribute to a lot of knee pain. And you'll know if you're watching this video, this is something you need worked.
It's a good area there.
Yeah.
You feel it starting to build. Yeah. You feel that knot thing there. Yep.
Yeah. And so we're trying to just clear out from the knee. So yeah, we've done a couple of strokes down, but then we also want to clear this part away as well. Get it into the middle of the quad where it's easier to flush it away. So yeah, not afraid to go if we actually have to go onto the knee and sit in here. We can just pin a spot in the knee there because there's a lot of fascia and a lot of connective tissue that encapsulates the knee that can also be stuck in here. So yeah, a lot of places you're told don't treat on top of the knee or don't treat on the knee, but sometimes you need to go there.
That feels really good there.
If you haven't had any relief from the traditional treatment, then this is probably what you'll need.
Yeah.
And this is where we can go.
It's really good.
It does feel therapeutic, doesn't
yeah,
it?
it feels,
have that bone worked.
Yeah. Feels really good.
And we'll come around. We can do another line. So I'm going to go slightly under the ITB this time. So bottom side of it. So hooking in. And tracing up there. Again, just feeling there's a bit going on there. Yeah, ITB is a common issue that can cause knee pain. And you don't just have to treat the ITB, we can treat the muscles that have a fascial connection with it, so that can have a big result as well. Alright, so once we're happy, we've done a few strokes through there, we've cleaned that area up, we can actually treat down on the patella tendon. So we can start with a palm, so we can just give it a bit of a nice warm up. So we're sinking into that tendon. So picking up the slack, sink in. So I've just got this part of my palm is in contact with that tendon. And we're just seeing what we get there. How's it feeling, Ninj?
Yeah, that's fine. That's fine. Feel like
so
as
it's
you
not too tender there.
get up into the kneecap, there's going to be some.
Yeah.
I can sense it's going to be therapeutic already.
Yeah. So we can come out there, and we'll just start. So more of the forearm, blade of the forearm, but just sinking in there, nice and slow. And again, this will look. You'll be like, what the hell is he doing here? But yeah, if this is done right to you, and it feels amazing, doesn't it, Ninja?
Correct. Correct.
It's just a part of the knee that takes so much load when you're squatting, lunging, running, accelerating, decelerating when you're running. So much load comes through this area that, yeah, this is where a lot of pain, particularly if you're rehabbing a knee injury, yeah, you're always focusing on strengthening around here. But if you don't treat it as well, that's what can lead to a lot of pain. So up in there.
Yeah.
Yeah. So we're just pinning that tendon and holding there. We can slightly go to the outside of it, slightly onto the medial side. Just tracing, trying to find where that sore spot is for you. So yeah, not afraid to go where the pain is.
Treated that big lump in that knee. You know, people get that lump.
Yeah, people, you can get that growth, Osgood Slatters,
Yep,
I think
yep.
it is. So this can help with that as well. So you can, yeah, pin this tendon, because that's like a lot of pulling and tension on that bone, and that's what causes it, is that sort of calcification of the tissues growing too quickly. And we can sink out. And if we need to be a bit more pinpoint, we can get a thumb, and this way we can either access it from inside or lateral and push in, or we can come medial and push out under that tendon. How we going, Ninja? You all right there? He's having a captain snooze.
Having another
Not
sleep.
enough.
Yeah. Relaxing.
That's it. So yeah, once we've worked that tendon, we'll continue to move on. So again, as I said, we can focus more on these areas, but I just want to show you pretty much everything we can get done. So medial side of the knee, all these tissues here where your adductors come down, your VMO attaches, there's a junction point in here that is pretty nasty for a lot of people. So we'll see how Ninja's feeling in here. Oh, there's a few flickers of some of those tendons and those bands of fascia.
Whoa.
And that's this junction point here, right where that adductor and VMO junction is.
That woke me up.
That'll wake you up in the morning. But yeah, again, it can refer into the knee, sort of into the front of the knee.
Whoa.
Sometimes it can feel deep. And just tracing up. Hit that spot there. Hold it and pin it.
Oh, fuck.
Localized Ninja, or are you feeling that go?
Oh, that was local, but
Yeah.
it's pretty intense. Yeah.
Yeah.
Just right where the... Oh, I feel like it's where your thumb is, but it might be the pisiform.
Yeah, more pisiform. Using the palm.
Yeah, it's pisiform.
Yeah, up there.
It's a bit deceptive. It's bloody good.
And then, yeah, again, you can start on the knee there. So you can start medial there, and then we're just going to roll in, slowly scooping it out. You feel some blocks there. And then drop into that area where the adductors attach. Oh, yeah. And it'll look nasty, but you know this will be good for you.
Ah, dear.
Just like that ITB on the lateral side, this is where you just got to take a few deep breaths and get through it. But yeah, if you've seen everyone, you've been through everything and it hasn't worked, yeah, you'll be willing to cop this because it'll be good for you.
Oh,
Won't it, Ninja?
yeah.
Look at it, it's good for you.
money spots
He's
everywhere.
loving it.
Money spots.
Yeah, there's money spots all through this area.
Yeah, you know them when you feel them. Meaningful.
Back more on that VMO. Working through.
What's VMO stand for, Jace?
Vastus medialis.
What is it? Oh, don't know. Oblique.
Something like that, Leo.
Ah.
What do you reckon? Don't know why.
Anyway.
Ninja's just throwing a grenade at me there.
Sorry, man.
Just exposed my nose. VMO, that's all you need to know. It's this muscle here. To strengthen it, if you push your knee down in the table, Ninja, you'll see it pop up there. Yeah, that's the big one there. That's VMO. You'll see it on a lot of bike riders or sprinters.
Or ninjas.
Or ninjas, yeah. So for that, we'll move on. We'll get Ninja over onto his stomach and we'll show you another trick.
Sorry, you want to?
No, I was just going to move it for you. Here you go. You got your mic in the way. So All right, make sure I treat the same knee. That's
Right,
this one.
yeah.
So this is the gold. This is the one that you've probably seen before, but again, popliteus. So if someone's had a ligament sprain or tear or rupture, the muscle known as popliteus at the back of the knee here, quite often it will lock on to work as replacement for that knee, particularly if it's an anterior cruciate ligament injury or ACL. So we can lift the knee up there and we're sinking, and you can normally feel a ball of tissue, and in there,
Yeah.
the ninja, I can feel that. So yeah,
nice.
this muscle, because it crosses the knee, similar to that sort of line of the ACL, it starts to lock and protect the knee, so you can't fully flex and you can't fully extend the knee because this
Whoa.
muscle locks on to protect.
Whoa.
But it's common to cause a lot of pain, not just at the back of the knee, like it can cause pain in the front of the knee because you're not able to move that knee efficiently and effectively. So we're just slowly doing these little oscillations because it is pretty brutal, and this is just helping to floss that muscle. And then just let Ninja relax there. So yeah, there's a pretty big ball in there. Feels like a little golf ball. But yeah, if you haven't had this part of the knee worked, this could be the thing that unlocks your pain.
So you got to be careful back there when you're like...
Yeah, you got to be careful because
nerves
there
and
are a lot of
arteries.
nerves and arteries and vessels that are around here. But as you can see, we're just before the gastroc attachments there, you can see, and we're angling in. He's got some juice in there.
Yeah, it's all right.
And yeah, to make it a bit easier, we can shorten it, and that'll make it a bit easier for Ninja to handle. And then as we lengthen it out, because that tissue's getting a bit more length through it, it'll pop up, and then we can shorten it again. So just pinning this area. And it is a pretty nasty one, so you've just got to take your time getting there. You can provide a bit, you might even bring the knee right into flexion, because that's where you'll feel when it starts to lock on and might limit their movement. And we'll give him a little break there. And we'll shuffle a bit more lateral, just to see, I can feel another little lump there that Ninja's going to love. And we'll sink in slowly. Yeah, this can all have an effect on persistent knee pain. And just bring it up. And yeah, again, we could nearly spend a whole session on top of the calf and popliteus for focusing on knee pain. But yeah, we want to cover a lot of areas and get it done. We can go more medial. In here is going to be, again, another nasty one there. Because that's the line, so it's coming over here and attaching onto that tibia.
Ooh.
Yeah. You can feel it lock on when you start to shorten it. Couple of deep breaths in. What are you feeling there on the table? Sharp?
When you got on that spot initially, I was pretty sharp, and I felt like something was worse than what it was.
Yeah.
I was just protecting myself, so... Now it's not too bad. I've sort of settled and surrendered to what you're doing.
Yeah. Alright, but we might let him drop down there. But yeah, we'll wrap it up there for today. But yeah, if you've got knee pain or if you're a practitioner treating someone that's not getting any relief, these are the areas you can target. So yeah, front of the knee, quads, lateral, medial, quad tendon or patella tendon, popliteus, any of these areas you can go to and have a work, and yeah, just get through as much as you can that affects the knee, and then yeah, we can get you in the gym and get you stronger and fix your pain. So yeah, if you're having any of these issues, come in and see us or see one of our practitioners, and yeah, we'll sort you out.